As COVID cases worldwide could be reaching 100 million within the next few days, how can we bring the pandemic under control? And how worried should we be in dealing with the new COVID variant? Thank you.
Thank you. Dr. Ryan?
Maria, please. Maria will certainly follow up. And that milestone is a grim and shocking one as we do approach it. Bringing the again, I think I said it in my previous comments. We have the prospects of vaccines that we fundamentally believe will have a major impact and relatively quickly once we have vulnerable populations vaccinated on severe disease and on mortality. And that's the first thing we need to deal with, those who are getting severely ill and dying from this disease. We then believe that obviously vaccination at high enough levels can help us with controlling the disease. But we have, and countries have, again, many countries in the world have demonstrated that this disease has a high element of controllability and have actually gone on and done that. Others have not been so lucky for different reasons. The disease has come early, it has entered silently, they've been caught unawares, they haven't been able to sustain a response over a long period of time, surveillance systems have been weak, the populations have not been willing or able to implement long-term behavioural measures or comply with quarantine and isolation, and the list goes on. But again, this disease can be significantly controlled by the application of the measures that we have been outlining here for a year, by the implementation of a comprehensive strategy that focuses on reducing transmission, on reducing mortality, and on developing the tools that Bruce and so many others have been working on over the last year. So I'd love to be here with new answers for you. I'd love to be here saying there are other things we can do. All we can do is pick ourselves up and take the fight back to the virus. For those of you who have the virus under control, do not lose control. Look at what other countries are suffering as they have lost control of the virus. So if you're in a low incidence or a zero incidence situation, keep it up. It is worth the effort. If you're in as many countries are, in a difficult transmission environment right now, there are no other options but to do what you've done before. I see in my own country, in Ireland, which has suffered a massive increase in cases over the last number of weeks, had done extremely well in 2 surges of disease, had brought the disease under control, and has suffered one of the most acute increases in disease incidence of any country in the world over the last number of months, and not due to the variant, let me add, but mainly due to increased social mixing and reduction in physical distancing. The government and the authorities there have taken, and the community have taken immediate action over the last 2 weeks, and already we're starting, the disease numbers starting to drop, the positivity rates starting to drop, and we are seeing the National Virus Reference Laboratory there doing superb surveillance for the new variant strains, which they are tracking. They have not been the driver of new transmission, but new variants can and will emerge. Some will be not significant in terms of transmission or in terms of severity. Some may be, and that is why we need a comprehensive monitoring framework to keep an eye on those and ensure that our measures are adapted as needed. Right now, there is no evidence that variants are driving any element of severity. There is some evidence that variants may be increasing or adding to transmission and in some sense giving some extra transmissibility to the virus. I was talking to my colleague Tony Houlihan, the Chief Medical Officer in Ireland earlier, and we were almost saying like this was like adding a substitution in the second half of a football game. It doesn't change the rules of the game, it doesn't change what you do, but it gives the virus some new energy, some new impetus. It adds to the challenge you face because the opposition is bringing on some new players to the field. It doesn't change the rules of the game, though. It doesn't change what we need to do to win. It just changes the strength of the opponent. And in that sense, we have to take from that that we just need to redouble our efforts.